Welcome to a new video. This video is on psychological disorders and interventions. Dr. Yonglin Wang was invited as a guest speaker in the general psychology course. She gave me the permission to share the slides for the purpose of making this video. This video will span across different topics. The first one we will cover is about abnormal behavior, and then we will go into the diagnosis and different types of disorders, and finally we will end with the treatment. Let's first talk about the history of abnormal behavior. In the ancient cultures like Egypt, people believed that spirits will control basically everything, including the environment and what people do. They came up with different treatment options like trepanation, which is a method to create a hole in the skull to help release the evil spirits. However, only 40% of people will survive due to infection. They also utilize other treatment options like exorcism, so it is also removing evil spirits through prayer, magic, starvation, or flogging. So flogging is to beat someone with a whip or a stick. Although in the ancient cultures, people began to identify abnormality in behavior, determining what is considered normal and what isn't was challenging. And nowadays, we commonly say that a behavior is abnormal when it is not consistent with the person's developmental, cultural, or social norms, and it also creates significant emotional distress. So we use 4 Ds to describe this. The first one is deviance, like deviance from the norm, feeling distressed and also dysfunction about daily functioning. And then for danger, people may engage in self-harming behaviors. There are many different causes of psychopathology, including biological, health conditions, psychological, environmental, and also socio-economical factors. For biological factors, it may involve a disruption in the physical functioning in the brain. For example, neurotransmitters, brain activity, and also the size of ventricles have been found to play a role in psychopathology. And for long-term health conditions, imagine an individual with chronic conditions will experience a lot of stress. They may feel tired, frustrated, and also worried when dealing with pain, which makes them more easy to experience or develop anxiety or depression. Certain forms of cognitions and psychological factors like thinking patterns, personality, like neuroticism and low self-esteem, and also the experience of long-term stress may heighten the risk of mental illnesses. For environmental factors, like the experience of certain traumatic life events, such as war or terrorist attack, these things may also increase the chances of developing psychopathology. And finally, for socio-economical factors, low income, unemployment, and racial discrimination could also be factors associated with the development of disease. To acknowledge the fact that there are many different factors that contribute to the development of psychopathology, here we have the biopsychosocial model. So this is a systemic approach that recognizes that different factors may contribute to the illness. To illustrate the biopsychosocial model, let's use anorexia nervosa, which is a form of eating disorders, as an example. For the biological factors, it could be due to imbalance of serotonin in the brain. Then moving on to the psychological factors, this person may have distorted thoughts about their body weight and also body image. And finally, for social factors, it could be due to the societal view that views beauty as being thin. Researchers have utilized the biopsychosocial model as a basis of understanding the mechanisms behind different mental disorders. The current trend in clinical psychology is to use the scientist-practitioner approach. Some of my students tell me that it is hard to apply difficult psychology concepts to real life. When we bring science into practice, sometimes we can solve problems, but sometimes we cannot, due to low feasibility and also practical considerations. The scientist-practitioner approach is trying to narrow down the gap between research and practice. So we may use research findings to guide practice, but at the same time, we may use clinical experience or observation to guide research questions. Now, let's distinguish different types of mental health professionals in Taiwan. A psychiatrist will need to earn a medical degree, but for both clinical and counseling psychologists, they will earn a master's degree. In terms of work context, psychiatrists and clinical psychologists both may work in the hospital, but clinical psychologists may also work in private practice. And for counseling psychologists, they may work in academic institutions or in the community. To make a diagnosis, only psychiatrists and clinical psychologists can do so. And in terms of prescribing medication, only psychiatrists can do so. In terms of job description, psychiatrists may prescribe medication and also give psychotherapy. In contrast, clinical psychologists could not give medication. And for counseling psychologists, the main job that they do would be to give guidance. And in terms of severity, psychiatrists and clinical psychologists may deal with people with mental disorders, but counseling psychologists may work with clients with day-to-day problems. When a person is experiencing psychological problems, they may undergo clinical assessment. This is the process of gathering information about that person and that person's environment to make decisions about the nature, status, and treatment of psychological issues. It may begin with a set of referral questions. For example, what questions does the client want to know about their current state or about their symptoms? Then they will determine the goals of the assessment. It could be making a diagnosis or learning about the prognosis of disease. And they may also engage in treatment planning, so the clinician will decide what they want to get out of this assessment. And later on, they will select the appropriate psychological tools to assess the illness. In contrast to clinical assessment, screeners are not meant to make a diagnosis. However, they are used to identify potential psychological problems or predict the risk of developing problems in the future. It is usually a brief assessment, and we may use different cutoff scores to identify the risk. Here is a slide on different types of assessment instruments. It could be self-report, so the client rate the problems themselves, or it could be client-rated measures. And for behavioral assessments, it could be based on monitoring or observation. And for psychophysiological assessments, it could be measuring skin conduction, or pupil diameter and eye movements and brain activities. So these may give an objective assessment of their current state. Clinical interview is a form of clinical assessment. The goal is to gather information on developmental history, the life events that the client experienced, and also any other medical history. Then it could be used to make a diagnosis and plan for their treatment. And after the treatment, it could be used to evaluate the outcome. Clinical interviews can be unstructured or structured. Typically, the first question is, what brings you here today? In our research methods video, we talked about the importance of considering the reliability and also validity of the assessment tool. A reliable measure should produce a consistent result. So for example, this person has depression yesterday, this person should also have it today. And for validity, it is that the measure is measuring depression, but not anxiety or any other disorders. Here in diagnosis, we refer to sensitivity and specificity. Sensitivity is that the test can actually identify the problem or mental disorder. And for specificity, it is the fact that the test can actually suggest that the problem is not here. When making an assessment, there are developmental and cultural considerations to keep in mind, and the diagnostic criteria may also vary across the lifespan. There are also gender differences in the prevalence rates of mental disorders. For example, there are more women to have depression, and that there are more men having substance abuse disorders. And differences in symptoms and disorders are also found among different ethnicity and race. In cultural research, they have found that Asian people tend to express positive emotions and hide their negative ones. Asian people tend to talk more about their physical symptoms rather than about their mental health issues. For instance, 神经衰弱 is a culturally acceptable diagnosis in Asian cultures that can avoid the social stigma of having a diagnosis of a mental disorder. Psychologists use the DSM to classify disorders. It was first published in 1952, and it offers a common language and standard for classifying different mental disorders. To make a diagnosis, the symptoms must cause clinically significant distress and impairment in that individual's life, and it shouldn't be attributable to any other medical condition. So in the following slides, we will cover some of the mental disorders, but due to limited time, we won't be able to cover all. First, let's talk about anxiety disorders. It is a common disorder characterized by physical symptoms like racing heartbeat, shortness of breath, sweating, and also muscle tension. People may have future-oriented thoughts and wanting to escape or avoid certain behaviors. It is more likely to happen when people encounter new situations or anticipate a life-changing event. The experience of anxiety disorders are usually time-limited, and people may have abnormal high levels of anxiety and cause functional impairment like diminished social relationships, poor well-being, and also low life satisfaction. And they may experience cognitive distress. Then the next disorder we will cover is generalized anxiety disorder. This is the excessive and unrealistic worry about a range of different things. Here are the characteristics of worry. So it should be excessive, feeling uncontrollable, and being accompanied by different physical symptoms, like what we have just covered, tension, restlessness, and also being easily fatigued and having weaker concentration. So the symptoms occurs more often than not for at least 6 months. Research has found that it is more commonly found among those who are in the lower socioeconomic status and among adults. It is ironic that worry prevents a person from feeling anxious, but it is not considered an effective coping strategy because it is time-consuming. And 91% of worries actually wouldn't come true. And it is also associated with other negative outcomes like having poor concentration, sleep disturbances, and also procrastination. Another form of anxiety disorder is social anxiety disorder. This is the intense fear of being watched or judged by the presence of others. It is different from the personality trait of shyness. There are some situations that create distress, like speaking or eating in front of others, engaging in social interactions, or starting a conversation. And for those who have social anxiety disorder, they may avoid a range of different social activities, and the average age of onset is during around 11 to 13 years old. Panic attacks is characterized by a sudden episode of intense fear that something bad is going to happen, but it usually occurs without any warning or apparent cause. The attack will occur frequently and also unexpectedly, and accompanied by different physical symptoms like body tremors, sweating, racing heartbeat, and dizziness. There are more adults reported having a panic attack compared to those who have a panic disorder. There are different causes and development. So for those who have hypersensitivity, that is greater awareness about their body sensations, are more likely to have panic attacks. And those who have panic attacks may develop agoraphobia, which is to avoid certain places that they have experienced the attack. Now let's move on to specific phobias. This is to be fearful about something, but the degree has to be severe and persistent that leads to a significant disruption in their daily functioning. There are 4 different groups. For animal phobias, it could include insects, snakes, and birds. And for nature environment phobias, it could be being in high places or experiencing storms, thunder, or lightning, or being in the water. And for blood injection and injury phobias, these persons may be afraid about needles. And for situational phobias, it could be traveling on bus, or cars, or trains, or going on a plane, or even visiting the dentist or visiting the hospital. So these different situations may create fearfulness. Most people develop these phobias during childhood, and the average age onset is 7 years old. Post-traumatic stress disorder is a mental health condition triggered by the experience of a terrifying event. It could be a natural disaster, cruel abuse, serious injury, or any threatened death. So symptoms may include having flashbacks, like rethinking the situation, being avoidance of certain places or behaviors, diminished emotions, or having excessive arousal. They may even have memory or concentration difficulties and feeling helplessness. And up to 92% of people have a comorbid. So this is more commonly found in those who have depression and anxiety. Although stressful things may create symptoms of anxiety and depression, but not all traumas will lead to the development of post-traumatic stress disorder. Here are the symptoms associated with major depressive disorders. It may include having low mood for a period of time, feelings of worthlessness, shame, and guilt, increased or decreased appetite, sleeping too little or too much, having low energy, suicidal thoughts, or the loss of interest in pleasurable activities, known as anhedonia. So to make a diagnosis, the person must have 5 or more symptoms here, and for at least 2 weeks. Bipolar disorder is a different disorder compared to major depressive disorder. It includes mood alternations between manic and depressive episodes. The mania episode may include feelings of euphoria. The person may have lots of energy, spends a lot of money, and don't feel like they need to spend time eating and sleeping, and may have faster speech and racing thoughts. There are 3 different types of bipolar disorder. The first type is called BD1. The bipolar 1 is the presence of manic episodes that last for at least a week or more, and it is the most severe one that may require immediate hospital care. And for BD2, the hypomanic episode may last a few days and are less intense and severe compared to BD1. And finally, for BD3, this is called the cyclothymia, or alternating periods between hypomania and depression. Schizophrenia is also known as the split mind. This is to describe the split from reality. It involves major disturbances in thought, emotion, and behavior. There are positive symptoms, which is the presence of abnormal behaviors, like delusion, believing others are following them or harming them, or even believe that they have special powers. Also, hallucinations like seeing, hearing, smelling, tasting, or feeling things that doesn't exist. They may also have disorganized speech. They may say illogical things, respond to questions or with unrelated answers. They may also engage in unusual behaviors like smiling, laughing for no reason, and talking to themselves. Schizophrenia also involves negative symptoms. This is the absence of normal behaviors. They may have a flat affect, so appearing to be having no emotions, and they may lack engagement in normal daily social activities. Now, let's talk about obsessive-compulsive disorders. Obsessions are unwanted thoughts. For example, fear of contamination is the most common one, and people may be fearful about making a mistake. Compulsions are repetitive, ritualistic behaviors. So if you are fearful about contamination, you may wash your hands repeatedly. Other common behaviors include checking the doors to see if they are locked, or checking the stove to make sure it's turned off. And you may engage in certain patterns of counting behaviors or arranging objects in a certain way. People often use the word obsessed nowadays, but obsessive-compulsive disorder is a more extreme one, and it can take up to hours of a person's day to get things done. So OCD is a condition that involves obsessions and combined with compulsions that is extensive, time-consuming, and also emotionally distressful. The first onset is late adolescence or early adulthood, and it usually occurs due to a major life stressor. They have found that when symptoms are present during childhood, OCD is more severe. I've included a video link below. You can watch the video for more demonstration. Hoarding disorder is classified as persistent difficulties in throwing away things, regardless of their actual value. People may feel perceived need to save the items. The first symptoms usually occur at around 11 to 15 years, and the severity increases over time. Past research suspects that there seems to be a genetic influence. Around 50% of individuals who hoard report having a relative or family member who also do the same thing. The rates are similar across gender. Trichotillomania is the intense urge to pull their hair out, sometimes in response to a stressful situation or without really thinking about it. People may feel a sense of relief after the behavior, but may have feelings of shame and low self-esteem at the same time. It can occur at any region of the body and can change over time. It's more commonly found among females, teenagers, and young adults, and those with obsessive-compulsive disorder. There are different ways to reduce this. For example, squeezing a stress ball or put plasters on your fingertips to avoid damage. Similar to hair pulling, another disorder is called excoriation. This is to pick your skin. This is by recurrent skin picking and may result in skin lesions. The most common areas include the face, arms, and hands, and people may spend a lot of time on this and can be several hours a day. It's more commonly found among females and those with obsessive-compulsive disorder. And one solution is to trim your nails and also keep tweezers away to reduce these abnormal behaviors. There are different types of eating disorders. Anorexia nervosa is the intense fear of gaining weight, even if the individual is already severely underweight. They may restrict their food intake and engage in excessive exercising behaviors. It typically develops around adolescence or young adulthood, and more commonly found among women. For bulimia nervosa, it is to engage in binge eating lots of food in a brief amount of time. But they may follow by purging through the use of laxative to get the food out. People with bulimia nervosa usually have a healthy normal body weight, but they have self-esteem and body image issues. There are also other types of eating disorders, like orthorexia nervosa. This is to engage in healthy eating that is quite repetitive and restrictive. Body dysmorphic disorder tends to be focused on specific areas of the body and being unsatisfied with defects or minor flaws. They may have extreme exaggeration of minor flaws. For women, it may be around the hips and thighs area, and for men, they may be worried about thinning hair, genitals, or muscle areas. The age of onset is around 15 years old, and people may consider suicide at least once and may seek plastic surgery to fix the problems. We have covered a lot of disorders so far, and we will end with somatic symptom and related disorders, as well as dissociative disorders. Somatic symptom disorders relate to excessive thoughts, feelings, and behaviors related to the physical body. However, it can't be explained by medical or psychological disorder. The client believes that they are sick, but it is unclear why they are. The onset is unclear, but it may be associated with stress or trauma. There are 4 different types, and we will go through one by one. First, somatic symptom disorder is once called hysteria. People have high levels of attention about their bodily symptoms, like back pain, shortness of breath, and heart beating. Conversion disorder is the experience of motor paralysis or sensory dysfunction, like blindness, but it is not explained by a neurological or medical condition. Moving on to illness anxiety disorder. This is fear or concerns about having an illness despite having medical reassurance. And finally, for factitious disorder, people may deceive others by appearing sick. So they may be faking body temperature or putting blood in urine, and may be faking depression. The cause of these different symptoms is unclear. However, it is not associated with wanting to receive external incentive or reward. Common treatments include cognitive behavioral therapy and biofeedback. Finally, we will end with dissociative disorders. This is to involve a disruption of consciousness, memory, identity, and also perception. There are 5 different types. Depersonalization is floating above their own body and watching themselves behave. Derealization is feeling as if people were in a dream. And amnesia is not being able to remember their own personal information. For identity confusion, this is being unclear about their own identity. And finally, identity alternation is to act or behave like a different person. Although we have covered the disorders individually, in real life, it is rather that people may have more than one disorder at once. That is what we call comorbidity. Around half of people who have one disorder will also meet criteria for having another disorder. The reason why comorbidity is high is that the risk factors between different disorders overlaps, and many disorders are not treated. For example, if social anxiety disorder is left untreated for a long time, a person may also develop depression or other disorders like substance abuse in response to the anxiety symptoms. Therefore, early diagnosis and early treatment is very important. Psychotherapies are developed based on empirical evidence, so they are the treatment of psychological disorders. It may involve a client and a therapist, and it is performed by clinical psychologists. Sometimes in group therapy, it may also involve couples or other family members. Psychodynamic therapy is based on Freud. This is to dig through the unconscious mind. They believe that mental disorders are stemmed from repressed memories or impulses that is not socially appropriate. They uses free association and dream interpretation to reflect the patient's experience of the outside world. However, the efficacy is unknown. Humanistic and person-centered therapy is based on Abraham Maslow and Carl Rogers. It operates on the humanistic belief that the client has the capacity for growth and self-actualization. So the client is the expert on him or herself. So they help the client to find meaning and find their strengths and cultivate courage. The therapist will provide empathetic understanding and unconditional positive regard. This is to support the client regardless of what they say or does. The findings about its efficacy is mixed. Behavioral therapy is commonly used to treat phobias. For example, exposure therapy is when a client needs to face fears to get over them. And newer techniques have applied virtual reality to treat this type of disorders. The efficacy is more promising, so 70% see improvements. For social skills training, it can train complex behaviors like how to carry on a conversation for social anxiety disorders. And they may practice new skills during therapy and also in simulated situations. And sometimes the client will need to complete weekly homework assignments. And for relaxation training, it may include some techniques like mindfulness and meditation and breathing exercises to help reduce stress and treat sleep problems and hypertension. Here is an example of developing an exposure therapy for cynophobia, which is fear of dogs. You can see that the fear hierarchy will increase and the fear level would add up to 100%. So to help this person be not afraid of dogs, it may start from the very beginning, so only touching dog toys. And then after reaching different hierarchy or levels, the person would ultimately be trained to be able to touch a real dog. Cognitive behavioral therapy is still known to be the gold standard of psychotherapy nowadays. It helps clients change distorted cognitions and thoughts. And then with the client, they engage in hypothesis testing to see whether the worst thing actually happens. So the goal of this therapy is to help clients develop coping skills and behavioral changes. The efficacy is very promising, so 70% of patients improve. For copyright reasons, I cannot share different types of cognitive distortions here, but you may refer to the link below to see different types. If you are wondering whether psychotherapies work, based on hundreds of studies and reviews, it has been found that the average people who engages in psychotherapy is better off by the end of the treatment compared to 80% of those who don't receive any treatment. And only 3 to 10% of people become worse after therapy. Regardless of different forms and types of psychotherapy, they do have common features. So it involves support, so the therapist will support the client. And the therapist will help the client learn about themselves and new ways to view different challenges and problems. And all types of psychotherapy will involve suggestions for action. Apart from psychotherapies, psychiatrists may also prescribe medicine. For example, SSRIs are commonly used to treat depression, so changing the serotonin levels in the brain. Benzodiazepines are used to treat anxiety. Brain stimulation therapies are newer techniques to treat mental illnesses. ECT and TMS are both non-invasive and can be used to treat mental illnesses like major depression and also bipolar disorder. ECT uses small electric currents to trigger brief controlled seizures and can improve symptoms quite quickly. TMS can be used to treat depression, OCD, and PTSD, and it is painless. However, they do have mild side effects like headaches and dizziness. Psychosurgery have been used to treat generalized anxiety disorder, major depressive disorder, and also obsessive compulsive disorder. However, it is only considered if a patient has failed to benefit from any other types of medication and therapy. Cingulotomy is to insert thin probes into the brain and burn some parts of the brain tissue. Capsulotomy is to use a gamma knife surgery, a form of radiation, and makes precise lesions in the brain without actually opening the skull. We have covered quite a lot of different content in this video, but I do have some key take-home messages for you. First, diagnosis of a mental disorder is made by professionals, and it is normal to experience some of the symptoms that we have discussed today. And I would like you to be mindful of yourself and also other people's mental health around you. And don't be afraid to seek help. There are many useful resources around you, like the Student Counseling Center, and also you could use the Student Mental Health Leave to take care of yourself. I hope you enjoyed this video.